Just how healthy is Florida? Here with the findings of the American Health Ranking Study is Dr. Mayrene Hernandez with United Healthcare. Thank you for coming in. This report card, it's been out for quite a while, 29 years. But in terms of this year, how is Florida doing overall?
We have great news for Florida, actually. Florida is actually 29th. It's the best it has ever been in nearly 30 years of the report.
One of the highlights this time around is child immunizations.
Correct. We're actually 8th in the nation for covering our children with immunizations. I'm one of those mommies that are pro-vaccine, and definitely that's a great ode to our future leaders. Right?
Yeah, a lot of push there, a lot of focus on that issue. Right. Florida ranked 12th in the country for a low rate of cancer deaths. What do you all attribute that to?
Wow, that was also wonderful. Yeah. Great news to my ears. Well, the report doesn't necessarily tell you the whys because it's data driven, right? Or any of the solutions. I like to pride myself as a clinician to say that's an ode to our clinicians, right? Absolutely. And also prevention. So the awareness of prevention with any cancer, the earlier you grab it and the earlier you diagnose it, the better it is.
It also seems like we have such a strong community of Susan G. Komen supporters, a lot of research done at the local level, and that seems to be rubbing off.
I agree.
The obesity rate at an all-time high nationally, where does Florida fall?
So interesting, Florida actually fell on the 14th nationally, on the 14th place. I was amazed and surprised to see this too. That basically correlates to roughly about 28% of our population is obese.
That's not too bad.
We're eating a little bit better, actually, but it seems that we're doing a lot better than the rest of the nation.
So when you take the study as a whole, some successes which you just highlighted.
Yes.
Where really are the areas where we can improve, room for improvement?
Well, the irony around correlation of the obesity and the physical inactivity, we actually ranked 36th in the physical inactivity part.
Oh.
We have great temperature, great weather. What happened there, right? I said that's an ironic finding.
Misnomer, yeah.
Right. Well, I find that, and again, it's in the clinical opinion here, is that I think it might be age-driven. Because we do have an aging population, probably an older population by comparison to the rest of the states.
Something else we picked up, mental health providers, we don't do so well, 41st in the nation?
That's correct. And it's funny because I kind of stipulate that it might be a supply and demand. And I think also as clinicians, we can generate awareness to seek help from these providers. So if it's a supply and demand and we're not necessarily going to get the right treatment, whether we're seeking help from a psychologist to deal with anxiety or depression, those providers actually migrate out of the state to other states. I'm throwing a lot at you,
and forgive me for this last question here. The overwhelming number of uninsured, it really is a weak spot for us as a state as well.
It is, and I think it might be associated in roughly about 13% of our population is uninsured by comparison to the rest of the states. And I think it might have a little bit something to do with our seasonality. We're actually very transient state, right? So we do have a combination of a lot of folks coming and going, right? So. Okay.
Dr. Hernandez, a numbers game, and you know your numbers.
Yes.
Thank you so much for sharing some of the outlines of that report. We appreciate it.